Good afternoon, everyone. I am Jennifer Ricketts-Swales, and I am the Vice Chair of the Human Services Committee. And please bear with me today, because this is my first time doing this, so feel free to correct me if you need to. First up, we have roll call.
Mrs. Burdick, Mrs. Ricketts-Swales.
Here.
Mrs. Hanchett. Here. Mr. Harris.
Here.
Mrs. Root. Here. Mr. Rumfelt.
Here.
And Mr. Stockin. 5 present, 1 absent.
Thank you. Next, we have approval of minutes from May 4th. I need someone to
Root will
motion.
make a motion.
Thank you.
Harris, second.
Thank you. Any discussion? All in favor?
Aye.
Thank you. Next on the agenda is Jamie Darcy, Deputy Public Health Director. Only it's not.
I'm back.
He's back.
Nice to see everyone. Monthly report, nothing significant to report on that. A couple highlights here. Our STI numbers are up just a little bit. That's sexually transmitted infections. We should see a trend back down now that the colleges are out of session. Some other highlights on here, lead poisoning prevention is down just slightly, which is a good thing. Did want to give you, of course, some COVID updates, just a brief one today. Our daily positivity rate sits at 3.6%. Our 7-day average is 8.6%. So just to give you some comparison, back on May 6th, we were at 9.6% for a daily positivity rate and a 9.07-day average. So we are down slightly. We are starting to see that trend down as well.
Good.
There was a question last committee I did watch online about monkeypox. We shouldn't be worried about monkeypox at this time. There are some cases in New York State. Of course, they're primarily associated with international travel. So we will tell residents, of course, if you are planning international travel, just be aware of the various diseases and viruses that you can come in contact with in other countries.
Looks like you have some requests for resolutions.
I do. The first request is similar to the probation department. We have a request to enter into an MOU with Healthy Families of Allegheny and Cattaraugus County.
Harris moves it.
Hanchett seconds.
Any questions? All in favor?
Aye.
Aye.
Opposed? So moved. You have another request for resolution?
Yes, so previously, Resolution 5722 provided for preschool provider rate increases. This is just a request to amend our current contracts with those providers in order to implement that increase.
Root will make a motion.
Rumfelt, second.
Thank you. Any questions? Motion, or, all in favor, excuse me?
Aye.
Opposed? So moved. The next request,
I have a request to fill one of our registered nurse positions due to resignation.
Harris moves it.
Root will second that.
any questions? All in favor?
I do. I have
Oh,
a question.
Oh, I'm so sorry.
I'm sorry. It just dawned on me. How many registered nurses do you have in your department?
I knew you were going to ask that. So I have technically, I do have a couple out at WIC, and they're in different unions. So total nurses in my entire department, I think I have 7.
7.
Yep.
Okay. And is this the only opening for registered nurses? Are they hard to
Yes.
find?
They are difficult to find. Yep, this was one of our added nurse positions for COVID responsibilities.
Okay.
Yep.
Thank you.
Any other questions? All in favor? Opposed? So moved. Finally, your last request.
Yes, I have a request to fill our typist position due to resignation as well.
Harris moves it.
Hanchett seconds.
Any questions? All in favor?
Aye.
Opposed? So moved. Thank you so much.
Thank you.
We really appreciate it. Welcome back. Yes. Next on our agenda is Miss Kays. Miss Edna Kays. Good
Tyler promised he
afternoon.
wouldn't shut off the microphone today, and he didn't, so that's a good thing. I brought Andrew Fanter. He's a caseworker from Adult Protective Services within our department to give you a little 5-minute
Okay.
talk about what he does.
Welcome, Andrew.
So obviously, I currently work as an adult protective services caseworker here at Allegheny County. I'm just going to give you a little bit of an overview of what we do in adult protective. We receive referrals for people in our community who range anywhere from 18 to 102 is the oldest I've had. There are 3 eligibility criteria that we assess for. First and foremost, the individual must have an impairment. That impairment can be anything physical, whether it's ambulation issues, diabetes, mental health, dementia, etc. Secondly, the individual must be experiencing unmet need or some kind of harm, which is directly connected to their impairment. An example may be, we'll just say Mrs. Smith, who has dementia, to the point that it's affecting her ability to manage her finances and pay her bills. We deal with environmental concerns such as hoarding, homelessness, animal infestations, and lack of utilities. We field referrals in regards to self-neglect and abuse by others, and investigate allegations of physical and mental abuse, as well as financial exploitation, and a variety of different scams. Unfortunately, financial exploitations is one of our more popular referrals. Our third criteria is assessing the ability and willingness of others to assist responsibly. This is where APS kind of takes a big role. We take a great deal of effort making sure that the individuals we work with are connected with the appropriate people who can assist in their situation, which may be family members, doctors, service providers, churches, and neighbors. Adult Protective is designed to be the last resort agency. Once we've linked our clients with the supports to alleviate the harm, that's when we close our case. Unlike Child Protective Services, our main tenet is not safety, but rather self-determination. Self-determination is one of the key components to all of our referrals. As adult protective workers, we have to consider the individual's capacity. Capacity is the ability of the individual to make rational decisions regarding their welfare. If we find someone to have capacity, we have to allow them to make sometimes even poor decisions or allow them to remain in unsafe situations. This can sound concerning to some. However, most of us would not appreciate the government coming in to force us out of our home or etc. We realize our inability to change certain situations can be frustrating for those who make referrals as well as community members. Sometimes there's a misconception that we have the authority to make people do certain things, such as go to nursing homes, receive medical care, relocating to a safer environment, or sometimes having charges filed criminally. That being said, we do have some tools that we can use when involuntary measures may be required. However, they're rare. One of the involuntary measures would be an access order, which is when we've been denied access to an individual who we believe may be experiencing harm or an unmet need. In these cases, we consult with a supervisor, a county attorney, and present the concern to one of our family court judges, who has the authority to grant us the access order, which we conduct with law enforcement. The next measure that we can take is called a STIPSO, which is short for a short-term involuntary protective services order. In this type of situation, an individual we have met with has been experiencing a medical emergency that we feel, if it's left unaddressed, could lead to serious injury or death, typically within 24 hours. And the individual appears to not comprehend the situation that they're in. Unfortunately, there are times when people who do have capacity can make the decisions for themselves. They understand that the lack of medical attention could potentially lead to their demise or death. However, we have to respect their wishes, but we will contact emergency services and kind of allow them to deny medical attention to the emergency services. In adult protective, we have the responsibility of being the legal guardian to individuals who have lost their capacity and do not have others who can responsibly fill that role. Currently in Allegheny County, we have 5 guardianship cases. Commissioner Kays here is technically the legal guardian for these 5 individuals, with Adult Protective conducting the casework. With guardianship cases, we have the duty of making decisions about their person and property. We've had to sell homes for these individuals, make medical and financial decisions, and unfortunately, end-of-life decisions. Given the work that we do with the adults in our community, we get to meet people from all different walks of life. No 2 cases are ever the same. We definitely get the pleasure of working with some great resources in our county, such as Office for the Aging, New York Connects, Accord, our colleagues at DSS, law enforcement, and many others. That's what I have.
Thank you so much.
Yeah, thank you.
Okay. So, the report, I move on to the report.
Yes, we're
Okay.
up. Monthly report is up.
So, do you have any questions to that? I think I have a big agenda today, so,
Yup.
okay. All right, so we have a request. Tell me when to, if you want.
You ready?
Okay, I'm ready.
Request
All
the
right.
first one.
We have a request to fill a senior account clerk typist due to retirement and any backfills. The annual salary of the position is $34,978 to $42,084. That's 0% state, 66% federal. And where's the count? Oh, it's offset by TANF. So it's currently in this year's budget.
So moved.
Root will second.
Are there any questions? So move then? Oh, whoops, sorry. If there's no questions, yeah, all in favor? Sorry.
Aye.
Aye. Opposed? So moved. Sorry, got a little hung up there. Next one on our list is for the account clerk typist. Or, excuse me, welfare examiner. That's the next one.
Social welfare examiner is due to a resignation. We're asking to fill that with any backfills. The annual salary is $36,107 to $43,885. That's 38% county, 10% state, 52% federal, and we're asking to fill that.
Root will move that.
Hanchett seconds.
Any questions? All in favor?
Aye.
Aye.
Opposed? So moved. Next, we have the social service investigator request.
Yes, with any resulting backfills, the annual salary is to that position is $40,908 to $50,967. It's 46% county, 7% state, 47% federal, and we're asking to be able to fill that.
Harris moves it.
Rumpfeld, second.
Any questions? All in favor?
Aye.
Opposed? So moved. The next one is for, oh,
County
sorry.
Madam Chairwoman, before you go on to the next resolution, that resolution and the subsequent resolutions, I believe, are a series of foster care contracts.
That's correct.
That the commissioner is going to be requesting resolutions for. What I would propose to be more efficient for this is that all of the contracts are the same. They're based on the same template, which my office has reviewed and approved. They're also for the same time period of July 1st, 2022 through June 30th, 2023. So what I would propose is that the commissioner, that this be done by one resolution be requested to approve the renewal of foster care contracts for the time period of July 1st, 2022 through June 30th, 2023 between the Department of Social Services. And then I would just ask the commissioner to list the various agencies for which the department wishes to contract with, and make a request for one resolution, and that would be brought before the board, the full board at the meeting, if the committee does approve the request for the resolution.
Do we need to vote on that as well, or no? Is that okay?
I believe that if the commission, although she did separate MOEs, I believe that you could just go ahead and do it all as one MOE
Okay.
right now. That would be fine.
Okay.
Yes.
Rumpfeld will make a motion that we do it as one.
Hanchett seconds.
Any questions?
Does she have to read the individual contracts right now?
She just needs to read the names of all of them
names all
into the
at
record.
once.
Yes.
Do you want me to? I can read them. Do you want to read them?
No,
You have them right
I'll
in
read
front
them.
of
Do
you?
you want to read them?
I don't want to read them.
Ms. Kays, would you please read the list and then we'll
Sure.
vote? Thank
So
you.
the list of our foster care contracts is Burke, and I'm sure, I don't know how much you're loving this, but I'm loving this right now. But anyways, Berkshire Farm Center and Services for Youth, Buffalo Urban League, Catholic Charities of the Diocese of Rochester, Catholic Charities Steuben Livingston, Child and Family Services, Children's Home of Wyoming Conference, Gateway Longview, Glove House, Gustavus Adolphus, Hillside Children's Center, Kids Peace National Centers of North America, New Directions Youth and Family Services, Pathways Incorporated, St. Anne's Institute, the William George Agency for Children's Services, Village of Hope Youth and Family Services.
And let me just restate that these are all foster care contracts.
They are all foster care contracts. The fiscal impact is it's paid per maximum state aid rate as needed with reimbursement based on eligibility, and they're all the same.
Do you have a motion for this?
I think we've got them already.
Do we?
Oh,
I
okay.
don't think we did.
Yeah.
Yeah.
Okay.
All in favor?
Aye.
Aye.
Any opposed? Any questions?
I'd just like to thank the county attorney for that.
Yes. As would I.
Hand me to.
I don't remember
next.
Carissa ever getting a round of applause in this
know.
chamber.
Our next request,
Okay.
we have more.
Okay, let me see. So our next request is a resolution requesting the approval of social services to enter into contract with Stephen DeMart for the rental of a four-bedroom home apartment. The tentative dates of the contract would be July 22 to June 2024. This money would be, the rooms would be paid for. It's one apartment with 3 bedrooms with the option of putting 4 bedrooms within the apartment. We would utilize the apartment for temporary housing assistance. We would also use the ESG funds, which we currently have, and that actually the moratorium has impeded us from utilizing these funds as were meant to be used. So we sought permission from OTDA to see if we could use it for an apartment. We pay for 1 month, one person in the hotel, we pay $1,800. If we utilize an apartment with 3 bedrooms where we can house 4 people, that's $2,000 a month for 4 people. So to me, it's a big savings, but we can also pay that money forward and utilize the apartment for 2 years. It would be local, so we could also check on it with our temporary housing unit and make sure that everybody is following the plans that are made when they're put into housing. How'd I do? I moved
Good,
okay,
very good.
I'll move it.
Thank you.
Hanchett seconds. Great idea.
All in favor? Or questions?
I have a question.
Sorry,
So excited about
2,000 a month, yeah, 2,000 a month for a
for all 4.
three bedroom, 4 bedroom.
that. 3-bedroom apartment can house 4 people. There's one huge room.
Is that fair market around here, do you think?
I have no idea what fair market is around here. What is it?
I don't know. Seems
Probably
high,
not
but
more
I'm just being seems high.
For 4 people,
It's just
Yeah.
bring Legislator Harris.
as opposed to 1,800 for the motel?
No, it's
For one?
cheaper, it's cheaper than the alternative, for sure. But that might not be the cheapest house out there to get, is all I'm saying.
Okay. Do you want me to keep looking?
Not for my benefit, no.
Okay.
Any other questions?
Typically, how long would they reside in this?
So it's temporary, so until they find housing, we have we have a living plan, an independent living plan that we develop with them in the effort to, they have to look up, they have to try to find so many houses. We talk to them daily. They have to find apartments. We help them to find apartments. We give them those that are available, that we know of, and hopefully to keep it moving so that we can put people in and out as
Would
they
this
become
help with the
homeless.
Code Blue too?
It could potentially help with the Code Blue, but we didn't put it in a
Okay.
Code Blue,
Okay.
in the Code Blue fashion.
Okay.
Other questions? All in favor?
Aye.
Opposed? So moved. And our final request?
Is we are looking to apply for the 2022 SNAP Process and Technology Improvement Grant, and looking to provide computer workstations for clients to use in-house and to improve our remote access.
Root will make the motion.
Oh, and the total request, I'm sorry, is $23,000.
Is there a second?
Rumpfeld, second.
Are there any questions? All in favor?
Aye.
Opposed? So moved. Thank you so
Thank
much
you.
to both you and the county attorney. Next on our agenda is Anita Madison, Office for the Aging Director. Welcome, Anita.
Thank you. Today I brought with me Karen Chamberlain, who's our volunteer coordinator, so she can give an overview of some of our services that we have through our office.
Fantastic.
Good afternoon.
Good afternoon.
I am the volunteer coordinator for the Office for the Aging. I've been in this position since 2016. Currently, I coordinate 9 volunteer programs with approximately 240 volunteers. Transportation is one of our large programs with the Office for the Aging. It is available to seniors Monday through Friday, taking seniors to medical appointments, grocery shopping, bank, pharmacy, post office, support groups and counseling, and Office for the Aging luncheon centers. I've read them to you in the order of priority, so as long as we have volunteers available and willing, we assist our seniors with going to those needed appointments. We have Meals on Wheels volunteers. I have 9 volunteer Meals on Wheels routes utilizing approximately 100 volunteers. That is also operating Monday through Friday, delivering meals to our seniors. We have tax counseling for the elderly. This is a seasonal program. I start contacting my volunteers in the late fall, and the main leader and I complete necessary training in November and December. Our lead tax volunteer provides instruction to the additional volunteers 2 weeks in January. For the 2020 tax season, we had 9 volunteers, 9 trained tax preparers, and 2 greeters. We served 548 seniors and completed 390 tax returns, bringing $332,183 back to our seniors. We have a handyman program. I have approximately 6 volunteers doing minor repairs for seniors, such as installing grab bars, repairing or replacing leaky faucets, repairing a step or installing a grab bar or a railing. Clients are responsible for the costs for the materials needed for the job. We also have a friendly visiting and a telephone reassurance program that offers a call or a visit by volunteers on a predetermined schedule for socialization and also for a health and safety check. We have senior luncheon centers that our volunteers assist the site manager with setup, serving, and cleanup. Currently, we have 8 open luncheon sites. I have an Allegheny County Fair booth. Volunteers man our fair booth for 2 hours at a time during Fair Week. Last, we have miscellaneous work done by volunteers. They assist in things like mailing our senior linings, which I believe I don't know, we send over 4,000 copies out. They do office jobs as needed and help us with our senior picnic. Volunteers dedicated to helping the Office for the Aging saves the county more than $218,000 annually. We are always looking for new volunteers. Pre-COVID, I averaged over 300 volunteers. We lost many volunteers for various different reasons. My position is very demanding, but without these volunteers, we would not be able to provide the level of services we currently do to our older adults. As we continue to grow our volunteer base, my goal is to designate more time directly to supporting my volunteers. In the human service packet, the last 2 pages, I've enclosed a volunteer opportunities list. At the back of the room here, I've left a few of my business cards as well as a few volunteer applications. If anybody's interested, feel free to reach out to me. Thank you.
Thank you so much. Monthly report.
Thank you. I have just a couple highlights.
Anita, can we
Yes.
ask Karen one question?
You can.
I'm sorry, I should have asked.
Hey Karen, not a question, just a quick request. Can you take those 2 pages and just make a standalone PDF out of them or something and email them to the board so we can distribute them? Okay. You could email them to Brenda and then
Brenda.
she can forward them in. Thanks.
Thank you.
We don't know what we would do without our volunteers. It really keeps us going, and Karen does a great job as our volunteer coordinator, managing over 240 volunteers. So, our monthly report, couple highlights for the month of April. This month last year for PC Level 1 services, which are the housekeeper chore, we had 853.75 hours of in-home housekeeper chore services. And this year we had 1,191.5 hours. That is partially due to the laborer positions that we have in only doing PC Level 1 services, not doing PC Level 2, which is personal care. Another highlight would be our caregiver services and ADCSI. A couple months ago, you did hear from Lynn Oyer, who is our Alzheimer's caregiver support case manager. This is partially her program as well as our 3E, which is our respite program. And last month, we had 203.25 hours of caregiver services and Alzheimer's support services, and this month we had 317.5. The other highlight that I had was the tax program, which Karen actually highlighted, and how much money we brought back in through our tax volunteer program, 332,833, but that was actually just refunds. So if you actually look at how much we saved an individual from having to pay to have taxes filed, we did an average of about $150 filing fee or preparation fee. Comes out to an additional $5,850 in savings for our older adults.
Huge.
And that's all from 9 volunteers. So, any questions on my monthly report? Okay.
You have a request for supplemental funding?
Yes. The request that we have is to accept supplemental funding for the OFA Unmet Needs Fund. This will run from April 1st, 2022 to March 31st, 2023 in the amount of $181,000 with only $1,000 being in contribution. The rest of it is state funds.
Root will make a motion to approve that, or to make a resolution, whatever.
Raumfeld, a second.
Any questions? All in favor?
Aye.
Any opposed? So moved.
Thank
And
you.
your second request?
This request is to fill a part-time typist position due to a promotion within our office. We did have a part-time typist take an account clerk typist position within our office, and we are looking to fill this. This is our front desk position. It is 10% county fund, 57% state fund, 20% federal, and 13% other, for a total of $37,872, and it is budgeted in the 2022 budget.
Harris moves.
Hanchett seconds.
Any questions? All in favor?
Aye.
Any opposed? So moved. And let me just say thank you. With a 94-year-old mother, I understand what you guys do, and it's so important, and I thank you so much for everything.
Thank you.
Next, are you all set?
Can I just make an announcement?
Sure, absolutely.
I would like everybody to mark on their calendars, August 16th is our senior picnic, with the 17th being a rain date. It is official, it is out, we have people signing up, but I just want to make sure that everybody here has it on their calendars to come and join us.
Location, fairgrounds.
Allegheny County Fairgrounds, starts at 11 o'clock, goes till 3 or whenever the last people are off the dance floor. So usually about 4, we have a couple of dancers.
That's great. Thank you so much.
Thank you.
Thank you.
Any old business? New business?
Madam Chairman, I'd just like to tell you what a lovely job you did conducting this meeting.
Thank you. Good for the order? If not, do I have a motion for adjournment?
Madam Chairman, I'd like to make, there appears to be no other business to come before Human Services. I'd like to make a motion to adjourn.
Root will second.
All in favor?
Aye.
Aye. So moved.